Welcome to Medin 5. The goal of our channel is to simplify medical concepts and help you understand them in a blink. Today, we're breaking down gram-negative cocci. Before we begin, think about these questions. Which gram-negative Diplococcus is frequently isolated from the sputum of smokers? Which one is linked to urethritis and pelvic inflammatory disease? Which one is responsible for meningitis outbreaks in dorms and military recruits? Stay on to learn more. Gram-negative cocci are spherical bacteria that stain pink with gram stain and usually appear in pairs. These microbes are often called Diplococci, meaning they occur in twos, resembling two coffee beans pressed together. Let's start with Neisseria gonorrhoeae, aka gonococcus. It's a gram-negative diplococcus that often shows up inside neutrophils on gram staining. It's oxidase positive and grows on selective media like Thayer-Martin agar. This microbe spreads through sexual contact and vertical transmission during childbirth, meaning it can pass from mother to baby during delivery. It causes gonorrhea, presenting as urethritis in men, and cervicitis or pelvic inflammatory disease in women. PID sometimes lack symptoms and can be hard to detect. Left untreated, it can cause infertility or widespread infection, producing septic arthritis or disseminated skin lesions. Key gonococcal virulence factors include pili and OPA proteins for attachment, IgA protease to evade mucosal defenses, and antigenic variation to dodge immunity. That variation means prior infection won't protect you from future infections. Gonorrhea may lead to reactive arthritis, an autoimmune complication that causes joint inflammation weeks after infection. This condition is more likely in people with HLA-B27, a gene that increases susceptibility to autoimmune conditions. The fast and sensitive nucleic acid amplification test is often used for diagnosis. Cultures help confirm the infection and determine suitable antibiotics. Treatment includes ceftriaxone. Doxycycline or azithromycin is added to cover possible chlamydia co-infection. Next is Neisseria meningitidis, aka meningococcus. It's another gram-negative diplococcus, but unlike gonococcus, it's encapsulated. The capsule helps it evade phagocytosis and makes it invasive. Meningococcus is a frequent cause of bacterial meningitis and septicemia, particularly in young adults in crowded settings like college dorms or military barracks. The bug spreads via respiratory droplets and starts with nasopharyngeal colonization. From there, it invades the bloodstream and central nervous system, leading to meningitis or meningococcemia, a bloodstream infection that can rapidly progress to shock and multi-organ failure. Symptoms may include fever, headache, stiff neck, a petechial rash, and rapid deterioration in fulminant cases. One dreaded complication is Waterhouse-Friderichsen syndrome, marked by massive bleeding into the adrenal glands, organs that produce cortisol and mineralocorticoids essential for blood pressure regulation. Adrenal failure arises, causing severe hypotension and shock. It's feared because it progresses rapidly and can be deadly if not treated immediately. Meningococcal virulence factors include the polysaccharide capsule, pili, IgA protease, and a potent endotoxin known as lipo-oligosaccharide. Group B strains, in particular, have capsules resembling human neural tissue, complicating vaccine development due to concerns about autoimmunity. Diagnosis involves gram stain and culture of cerebrospinal fluid, latex agglutination, or polymerase chain reaction. Treatment is empiric IV ceftriaxone. Close contacts must be given rifampin prophylaxis. The quadrivalent meningococcal vaccine is key to prevention. It's part of routine immunization worldwide. Next is Moraxella catarrhalis. It's a less famous, but still important member of this group. It's oxidase positive and beta-lactamase producing. It inhabits the respiratory tract. Moraxella is best known for causing otitis media and sinusitis in children, as well as COPD exacerbations in adults, especially smokers. It can also cause bronchitis and pneumonia, particularly in older adults. The illness often starts with mild respiratory symptoms but can escalate in people with chronic lung conditions, sometimes requiring antibiotics and supportive care. Diagnosis is usually clinical, but cultures from sputum or ear swabs may show the bug. Treatment options include amoxicillin clavulinate, macrolides, and cephalosporins. Let's review. Which gram-negative Diplococcus is frequently isolated from the sputum of smokers? Answer: M. catarrhalis. Which one is linked to urethritis and pelvic inflammatory disease? Answer: N. gonorrhoeae. Which one is responsible for meningitis outbreaks in dorms and military recruits? Answer: N. meningitidis. Figured them out? Smashing! Tap like, share, and subscribe if this video made things clearer about gram-negative cocci. Check out the summary table in the description to keep the details at your fingertips. Thanks for watching.